Hello, everyone. This is John Massa from the Center for Independent Living in Toronto. We had a few little technical glitches, and we want to welcome you. We're just signing on right now. We'll just take about a minute or two before we start so we can let everyone in. We appreciate your patience and understanding. And we'll just give it a couple of minutes. Once again, we're just waiting a few minutes until everyone signs on. I'd say we'll start in about a couple of minutes.
I think we can start now, John.
So I have a request for the ASL to start as well. Okay. Are you able to see the ASL, the person who's requested it?
I'm just checking in on the chat, John, because if for some reason the person's not able to see the interpreter, they won't be able to see the question.
Yes, thank you, Rebecca.
And yes, we are good to go.
Excellent. So I want to start off by welcoming everyone to Staying Safe with COVID-19, Changing Public Health Guidelines in Ontario and People with Disabilities. My name is John Massa. I am the Independent Living Skills Coordinator. I use the pronouns of he and him. And just to describe myself, I'm a person with a physical disability, a mobility disability, with complex care needs. I have very short black hair, mustache. I'm a white cisgender male. And as the speakers come up, if they could please use your preferred pronouns and describe yourself once you start speaking. And I'm going to move on to the next slide. So although this webinar is happening virtually, SILT is located in Toronto, and we would like to begin by acknowledging that the land on which we gather is the territory of the Haudenosaunee, and most recently the territory of the Mississauga of the Credit First Nation. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and the Allied Nations to peacefully share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, the meeting place of Toronto is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work in the community on this territory. Am I going at okay pace with ASL and captioning? Okay. So some workshop guidelines. We will be recording this workshop on Zoom and the questions and answers section so we can share with people with disabilities and our allies. The workshop is content heavy, but it's meant to empower you with information and resources, which is the independent living philosophy. For privacy and time management, everyone will be muted and no video except for the host will be allowed. If you have a specific question or comment for the facilitators, please ensure you type it in the chat box. And Rebecca, my co-facilitator, will be able to ask it during the Q&A section. Your question or comment will be anonymous in the final recording. If you need support too, please select Rebecca in the chat box and they will assist you. We want to co-create a space that everyone is felt heard and respected. And we also reserve the right to remove anyone from the webinar who does not follow these guidelines. So we've done the welcome, land acknowledgement, and brief introductions. We'll spend a short time on guideline. We did the guidelines, and then I'll pass it on to Tim for the objectives, and then Q&A for about 50 minutes or so, and then just a brief review of resources, evaluations, and thank yous. Just as a workshop disclaimer, the PowerPoint presentation is for general information purposes only. The information is current as of March 22nd, 2022. The information given is subject to change depending on possible policy, regulation, and law changes in Ontario. For the most current information, participants should check the Government of Ontario website and other websites mentioned in this presentation. As well, this presentation is a property of Timothy Valier, RPN, owner of Integrity Care Consultants, and neither whole or part is to be circulated without his express consent, and his contact number is 905-895-0842, and the workshop is based on Ontario IPAC practices. So our objectives for today, first is to talk about the current changes to public health requirements, the importance of infection control and routine practices for preventing infections, now more than ever with these mass mandate removals. 3, what causes and how to prevent flu and COVID. The importance of personal protective equipment, PPE, and different types of PPE and how to use it properly. A brief discussion of vaccine, boosters, rapid antigen tests, best practices if you or your staff test positive for COVID-19, and then questions and answers and resources. So briefly about us, the Center for Independent Living in Toronto, or CILT, is rooted in Nothing About Us Without Us disability rights movement. CILT is a community-based resource center run by people with disabilities, for people with disabilities. We work towards building a society where people with disabilities have social and economic equity. Our core programs assist people with disabilities to take control over their lives and to live independently in the community. And our core programs consist of information and referral, volunteer program, peer support, parenting with a disability network, the independent living skills training program, the attendant service application center, and the direct funding program. We believe in the independent living philosophy where people with disabilities are seen as consumers who have the right to examine choices, make decisions, take risks, make mistakes, and to take responsibilities for one's own life. So about our presenter, Timothy Valliere, he is RPN and owner and president of Integrity Care Consultants. He began his healthcare career in 1979. He is a healthcare educator. His experience includes development and operation of independent living and outreach programs for people with disabilities and seniors, and the development of nursing and home care service agency, bedside nursing and hospital, and hospice, and sales and marketing development and implementation. So I'm going to pass the presentation on to Tim.
Thanks so much, John. So as John said, my name is Timothy Valliere. I'm a short male like John with dark hair, very pale skin, blue eyes. I use the pronouns he and him, and I thank you all for participating today in this session. I hope to provide you with some information that will be helpful to you. I do have a French-Canadian background, and I tend to speak fast. So for everyone and the interpreters, don't be afraid to yell at me, to slow down. So I want to start off with some quick facts that came from Dr. Kieran Moore, who is our Chief Medical Officer of Health from March the 9th. With the peak of Omicron behind us, which is the variant of concern, Ontario has been able to cautiously and gradually move through its reopening milestones. Big emphasis on the word cautiously and gradually. With continued improvement in trends, Ontario will remove the mandatory mask requirements for most settings as of yesterday, March 21st, with the exception of select settings such as public transit, healthcare settings, long-term care homes, and congregate care settings. So I know people live in their own homes receiving services, but I think we want to remember that people are traveling to your home and can in fact be working in other healthcare settings. So really important to make sure that even though it is your own private home, it is still delivery of healthcare services. Okay, next slide. Am I doing the slides, John? Sorry.
No, I am.
Okay. There's a link for doing your own assessment that we're going to get to in just a minute. So capacity limits have been lifted in all indoor public settings. Proof of vaccination requirements have been lifted. Businesses and organizations may choose to require proof of vaccination upon entry. Other protective measures such as masks, face coverings, requirements, and passive screening of patrons remain in place. And businesses And organizations that are open must continue to have safety plans in place. Next slide. So we're going to talk about what we talked about exactly 1 year ago, actually, IPAC, which is Infection Prevention and Control. And what really the big focus is the prevention or reduction of the risk of transmission of microorganisms. And a simple word for that is the word germ. Our big focus is on prevention, and we're going to talk lots about a layered approach to that and about personal choice and people who still choose to want to wear masks. And I always like to talk about operating from a minimal risk and predictable outcome philosophy based on what we call a point of care risk assessment. Next slide. So some statistics that are updated from our last year's presentation of the nearly 56.9 million deaths in 2016, which is the most recent I could get from the WHO, which is the World Health Organization. Infectious diseases accounted for more than 17 million, or 1 in 3, and 3 million people died from respiratory infections alone, not counting COVID infections. According to the World Health Organization, there are 1 billion people annually who get the flu, and it's estimated that 290 to 650,000 people die of flu-related causes every single year. Those are typically our immunocompromised individuals, people over 65, under 12, and those with ongoing health conditions. Flu causes about 12,200 hospitalizations and 3,500 deaths in Canada every single year. Doctors and scientists are continuing to work to estimate the mortality of COVID-19. At present, it's thought to be substantially higher, possibly 10 times higher than that of the flu, which is not what we talked about a year ago. According to Johns Hopkins, and all of the references are on slide number 12 for you to research on your own if you want to get more up-to-date information. There's been approximately, according to Johns Hopkins, over 456 million COVID-19 cases with over 6 million deaths worldwide as of March 13th of this year. In Canada, the total case count for COVID-19 was 3.37 million and 37,278 deaths. In Ontario, it was 1.14 million with 12,638 deaths, and those stats are as of March 13th, 2022. So what does IPAC mean? It helps to protect you, your attendants, your family, your friends, others in our community, and others in the world. So a germ is a small living plant or animal that is seen microscopically. Some are harmful that can cause infections, and some are not. So there's pathogenic, which is infectable, and non-pathogenic, which does not cause infection. There's basically 4 types: bacteria, one-celled microbes. So bacteria is larger than a virus. So TB, for example, is a bacteria. Bacteria pneumonia is another example. Viruses are much smaller. They invade and they take over the actual DNA inside of a cell, and then cancer would be an example of that. Viruses like COVID-19 is an example. Fungi like to live on organic matter, such as plants or animal. We can get fungal infections, so athlete's foot, for example, yeast infections, and parasites like tapeworms that like to live on a host, being the individual. So on our hands alone, never mind our full body, but on our hands alone, we carry 10,000 to 10 million microorganisms. Our bodies have over 100 trillion microorganisms. Huge. Some are good and some are bad. What we want to do is keep the good ones. We want to make sure that the transient microorganisms that don't belong there, so Omicron is the variant of concern, and the new variant under Omicron, the B2, that likes to live on surfaces. So when we talk about transient microorganisms, we're talking about ones that are easy to remove by proper IPAC principles that we're going to cover in this session. And we have to remember that some people can be what we call asymptomatic. So A in front of any word in healthcare means absence of. So symptomatic would be I have a fever. Asymptomatic is I may have COVID, but I don't present with a fever because I'm asymptomatic. So I like to give a visual when I talk about viruses, bacteria, and good and bad. So if you think about baseball, and if there's any baseball fans out there, you'll know that it's an exciting time for baseball now. So the baseball itself, if we're looking at the whole baseball pitch, the baseball would be considered the size of the virus, okay? The pitcher's mound would represent the size of a bacteria. So already we see a difference between the size of a viral cell and a bacterial cell. But your own immune system is the entire baseball field with that 100 trillion good bacteria. It's in all of our orifices, nose, mouth, eyes, rectum, vagina, and that's where all of the good bacteria is. But we have to keep ourselves healthy. We have to make sure that we reduce our stress, that we get enough sleep, that we eat and drink appropriately. So what are some of the other healthcare acquired infections that we see in our community? Urinary tract infections, ESBL is very prevalent now, respiratory colds, pneumonia, bronchitis, flu, RSV, the respiratory syncytial virus, which is very big this time of year, especially in children 2 and under, and those who are older and compromised. GI systems like nausea, vomiting, diarrhea, and any wound discharge from infections. So there is a big impact and concentration and emphasis now on infection prevention, big word prevention, and we all know that having come through the last 2 years. Hep C was a big trigger for this, AIDS, avian flu, H1N1, SARS, hard to believe so long ago that we were working with SARS, and now of course COVID. And we have our antibiotic resistant organisms like MRSA and VRE, which all, again, are about prevention, which is what IPAC is all about, good infection prevention control. So the chain of transmission is represented by the 6 dots on slide number 20 that you see in front of you. So those 6 dots represent how infections are spread. And what we do is try to prevent that. And how you prevent it is by breaking the chain connecting those 6 dots. So let's start at the top with the infectious agent. Let's talk about Omicron. So Omicron is the infectious agent. It's a variant of concern of COVID-19 living in the respiratory system. Omicron is a much smaller droplet called an aerosol, and it lives in the respiratory system. So coughing, sneezing, it can get out of our body through our nose, through our mouth. It can land on a surface. When it lands on that surface, that mode of transmission can be direct by somebody touching it and then touching a mucous membrane of their own. It can be by being closer to somebody without the proper PPE on that we're going to talk about. The droplet, the airborne transmission, any of those things can allow it to transmit to another individual. So how it gets out of one person's body is how it gets into somebody else's body. So again, really, really important is IPAC and prevention. And we talk about susceptible hosts. So we used to say in healthcare, and I'm sure this is going to change once we're way past the COVID issues, and we're able to look at what a susceptible host truly is, because with this virus, I'm sure it's going to change. We used to say it was somebody under the age of 12 who had not yet reached puberty, somebody over the age of 65, or somebody who had a chronic disease process. That used to be what we called a susceptible host. But COVID has proven that wrong, and that there are lots of people with none of those conditions, and they are dying. And that's why vaccines and IPAC are so important to protect us. So routine practices are based on the premise that all of your bodily fluids, so just think of all your bodily fluids Intact skin means there's no cuts or breaks on our skin, are potentially infectious. So these practices describe prevention and control strategies to be used with all clients. So hand hygiene, the World Health Organization still says is the best thing. When hand washing isn't available, we're going to use alcohol-based hand rubs. We're going to watch a couple of videos on the proper way to do that, the proper way to use PPE. Alcohol-based hand rubs of 60 to 90%, depending on where you go. Some say 70 to 90% alcohol, some say 60 to 90%. Alcohol-based hand rubs are point of care readily available. So therefore, it's better than soap and water because of the fact of its availability. Using PPE to help protect us against those bodily fluids as well. So next slide. So if you have illness, any illness, because remember RSV, that's the time of year now, we get RSV. Cover your mouth and nose if you're coughing. If you use a tissue, make sure it goes into the garbage. Don't be like my adult children who like to throw them all over the living room floor and then, mom or dad picks them up. Cough into your elbow. Do not sneeze or cough towards anyone who's in front of you. Stay at least 2 meters or 6 feet away if you are coughing or sneezing. Visit your doctor for telehealth if your symptoms do not disappear. If they become worse, frequent hand washing. Wear your gloves. I mean, we're wearing PPE now because of COVID, but we're going to wear our gloves if we've got any cuts in our hand, visible or otherwise. Stay home from work or volunteering if you're sick. And always, always follow standard annual influenza and COVID immunization. A point of care risk assessment is your responsibility as somebody receiving care and our responsibility of those supporting those individuals and everybody else that you're socializing with. And remember, we all travel. We all are out in the world. There are people who take public transit. There are people on public transit who have good IPAC principles, and there are those who don't have good IPAC principles. No judgments, personal choice. So we want to think about what is my likely exposure to any bodily fluid, type of bodily fluid that my attendant may come into contact with you and or someone else they've cared for or someone else that used the bank machine or held on to the same bar on the bus or subway, the route of potential exposure to germs, the level of risk to you and the attendant, the time it takes to complete an activity. So with COVID, our sort of window is about 15 minutes. We want to keep everything sort of less than 15 minutes. Remember that word asymptomatic. Somebody with Omicron could be asymptomatic, have it, and the environment where the activity is being carried out with close contact with other people being present in the home. The flu is caused by a virus. The virus can live in your nose, mouth, eyes, ears, skin. There's type A, type B. It spreads very easily. Again, we want to stay 2 meters from somebody. A droplet is size-wise, a droplet is bigger than 10. They're called microns, not that you need to know that, but it's 10 and up is sort of the size of a droplet. Droplets tend to fall and aren't as contagious as aerosols, which are smaller, and aerosols love to stay up in the air, and therefore when you breathe in the concentrated amount of those aerosols, like Omicron, you can get sick. Remember, it can be on doorknobs, phones, tissues, kitchen utensils. So if you have multiple people in your home and you have multiple caregivers or support people in your home and they're not practicing, it just takes one person to touch something with germs and now they're spreading to everybody else that comes in contact with you. So COVID-19 was very much droplet in the beginning, and now with Omicron, it's been documented as airborne. So remember, it lives in the air. So again, things are changing dramatically. So me as a frontline nurse, I currently work in a hospital. I also work in a hospice environment. I teach in a college and I teach in a high school. So I'm out in the public a lot. So personally for me, I still wear my mask everywhere. When I go to the grocery store, when I'm going out for a walk, if I see people coming towards me, I put my mask on. Personal choice. For me, I'm in high-risk environments. I don't want to make anybody sick if I happen to be asymptomatic. So lots and lots of changes. So please make sure to visit Public Health, COVID-19 Ontario, COVID-19 Canada, the World Health Organization. If you're concerned about vaccines, NACI is a National Advisory on Community Immunization. All of this is in here as well. So there's a great video that John's going to show us now And it's about layering, and it's the importance of layering that will help to prevent the spread. I'm just going to mute myself so you don't get feedback.
Please tell me if you hear this video.
Hi, I'm Patricia Winokur. I'm an infectious disease specialist and executive dean in the Carver College of Medicine. I want to share with you how to stay safe from COVID-19. It's called the Swiss cheese model. Why Swiss cheese? The key is layers. This graphic helps illustrate how, while there are holes in the cheese, by combining the slices, we get a layered approach that leads to fewer holes. The same is true for COVID-19 prevention strategies. The strongest protection comes from getting vaccinated. You also protect yourself by wearing a mask, social distancing, avoiding crowds, and washing your hands often. Each of these are important ways to reduce your risk of getting COVID-19, but they become really effective when you combine them. Like the graphic illustrates, no one measure is 100% effective. The most important layer? Getting vaccinated. It's safe and very effective, but it's not 100%. It isn't a shield that will cause the virus to bounce off you. You can still get sick, but if you do, you're less likely to be hospitalized, less likely to have long-term COVID symptoms, and much less likely to die from the virus. So when heading out to work, to the store, or when around others, remember Swiss cheese. Get vaccinated, wear a mask, wash your hands often. The more steps you take, the safer you will be against COVID-19. If we do these things, we'll put COVID-19 behind us.
Awesome, thanks, John. So I noticed there was someone in the chat that had asked to make it bigger. So maybe when we play the next videos, we could hit that little box on the bottom right to enlarge them. So that's exactly what we want to do, is think about Swiss cheese. And the more layers you get, the better off you will be. And hopefully the people that are around you that don't practice Swiss cheese won't make you sick. So physical distancing, 2 meters is really important, avoiding crowded places, crowded spaces, close contact with individuals, and especially those high-risk individuals. Next slide. Proper hand hygiene can reduce the risk. It used to be 15 seconds. Now we're talking about 20 seconds when you wash your hands. So we're going to watch videos. I'll describe those videos. And again, alcohol-based hand sanitizer is important when we don't have access to soap and water. So cleaning with high-touch surfaces is also really important. And there are links to all of the reference material here at the end as well. But Health Canada has published a list of hard surface disinfectants that you can use. But please be sensitive to some of those people that you're providing care for who have sensitivity to smells. And some of those hard disinfectant surfaces can make it very difficult for them to breathe. So we want to make sure that we're conscientious of that. If someone, affordability can be an issue. We can't afford certain cleaners. So you can use a combination of 1 teaspoon, which is 5 mils, to 1 cup of household bleach to give yourself a cleaning solution that will clean just like in a hospital setting. And what you need to do is make sure that you're conscientious of where you're spraying that, because you don't want to get it on somebody's clothes or a piece of furniture that could get discolored. And what you do is when you make that solution, obviously you put a label on it so people know, and that solution is only good for 24 hours, kept out on the counter. Okay, and after 24 hours, it should be discarded and you make a new batch for the next 24 hours. So you don't want to make up a whole bunch of it, but you leave it on for 5 to 10 minutes and then wipe it off with a cloth. If you can afford disposable cloths like paper towels, those blue industrial paper towels, we can throw those in the garbage. And if you can't, then you're using cloths. Make sure they're cloths you don't care about because they're going to color change, but they should be washed at a very high temperature and dried on a high temperature if you're going to use them again. Remember those high-touch surfaces, door handles, bedside tables, television remotes, any equipment staff could be using to assist you with your supports need to be cleaned as well.
So Tim, it's 1 teaspoon of bleach for 1 cup of water.
That's the general recommendation from Health Canada. Yep. And good for 24 hours. So wearing masks or face covers, and I know we're all concerned. I mean, I personally am concerned and have seen not a huge change going to the grocery store today and yesterday, but definitely some people not wearing masks. But again, what we want to remember is we're Swiss cheese and we're trying to protect ourselves and other people with Omicron, that we're going to talk about some more statistics. It's really important to do what you feel comfortable with. So medical masks come in all different types of sizes. There's sort of 3 different, a level 1, a level 2, and a level 3. And the big difference is the further up you go. So a level 3 protects you much more so than a level 1. But a level 1 is sufficient for the droplet size that you would normally see with COVID. It is not sufficient for what they're saying about Omicron, because Omicron is an aerosol. So wearing it in high populated areas when you can't maintain physical distancing from individuals, like stores, shopping centers, public transit, going in a taxi, riding with someone else. I personally, as a nurse and as a father of 3 adult children, would encourage you to continue to do that, especially out into public, and if you're immunocompromised. Hand hygiene is the most important thing, again, according to the World Health Organization. And one of the things that we often note is forgetting the thumbs, people not cleaning their thumbs properly. So you'll see it in the video and also in the description I'll give while we walk through it. Fingernails, especially if someone's got artificial nails or nail extensions or chipped nails, bacteria and viruses love to grow in those dark, warm, moist little spots like under fake nails. So not a good practice for healthcare providers. The components of good hand washing: maintaining a nice, comfortable temperature. You don't want cold water, you don't want hot water. But the trick is in the friction that we create in that 20 seconds while we're washing our hands. We want to use 1 pump of soap. Don't lather up or don't put on, so much alcohol-based hand rub that you smell like somebody who's been sitting in a bar for the last hour. You want to use an appropriate amount. So 1 pump of soap. Rub your hands together, covering all the surfaces, creating some friction. We want to rub in between our fingers. So what I'm doing is I'm interlacing my fingers in my hands. What I'm doing is taking the palm of my hand and the opposite fingers and rubbing those into the opposite palm with my fingers and rubbing my fingernails in. And then I'm doing my thumbs really well, taking my one hand and cleaning my other thumb and washing the top of my hand and the palm of my hand until my hands are completely dry if I'm using alcohol-based hand rubs, or at least 20 seconds with soap and water, rinsing it thoroughly with our hands pointed downward, always away from our face, and then using a paper towel to dry your hands and putting that in the garbage. Obviously, not everybody has those types of things, so I would encourage you to take some old dish towels, and when I go to somebody's home as a nurse, I just tuck a dish towel in my back pocket. I use that for that person's home, and then I put it in a bag and I wash it with my dirty uniforms. So this slide is just, again, talking about 60 to 90% alcohol. Others say 70 to 90%, but minimum 60. Next slide. So for using alcohol-based hand rubs, we're going to apply 1.5 to 3 mils. So just to give you a visual reference, 5 mils is a teaspoon. So 1.5 to 3 mils. And again, we wash our hands the exact same way, rubbing our palms together, interlacing our fingers, making sure we get our thumbs, making sure we get the palms and our wrists. And remember that you can't, if you're going to be wearing gloves, which you need to do during COVID, your hands have to be completely dry or you'll never get the gloves on. And it is flammable, so just be careful. Not having a cigarette with your hands all covered in that. So when should you use it as an attendant service provider? At the beginning of your shift, before direct contact with the consumer, if you've coughed, sneezed, anything like that, especially when we've got our immunocompromised individuals who may be, diabetes, chemotherapy, any type of chronic disease process, Crohn's, colitis, IBS, fibromyalgia, anything like that, after you've had direct contact with anyone or direct contact with a new person. When you might have touched garbage, laundry, bedpans, things that have been contaminated, any bodily fluids, secretions from a client, excretions from a wound, and after going to the toilet. After blowing your nose, coughing in your hands, coughing, sneezing, before touching your face, you really, really want to make sure you're trying not to touch your face. You know, don't be one of those people who's constantly pulling your mask down to your chin or putting it up on your forehead. You want to make sure when your mask is on, your mask stays on, and when you're going to take it off for a drink or some other, to eat your lunch, you take it off and you change, hopefully you have a new mask to put on, or you put it on a clean surface face up. Before leaving the person's home, hand lotion is recommended. Every 11th time you wash your hands, you should put on good hand lotion, not cheap stuff. You want to keep your hands really, really nice and moisturized, that there's no breaks in your skin, which is where germs love to get in. So we're going to watch 3 videos. Slide number 38. The first one is going to be about washing hand rub, and then we're going to be watching about PPE. And again, if we can click it on, John, so people can see it bigger, that little box on the bottom right to make it bigger, and I'll just mute myself.
Check that your hands are visibly clean. If there is obvious soiling, follow the steps for hand washing. Apply 1 to 2 pumps of product to the palms of your dry hand. Rub your hands together, palm to palm. Rub in between and around your fingers. Rub the back of each hand with the palm of your other hand. Rub the fingertips of each hand in your opposite palm. Rub each thumb clasped in the opposite hand. Rub your hands until the product is dry. This will take a minimum of 15 seconds if sufficient product has been used. Wet your hands with warm water. Do not use water that is too hot or too cold, as it is hard on your skin and will lead to dryness. Apply liquid or foam soap. Lather the soap and rub your hands palm to palm. In healthcare settings, bar soap should not be used for hand washing because it is easily contaminated. Rub in between and around your fingers. Rub the back of each hand with the palm of your other hand. Rub the fingertips of each hand in your opposite palm. Rub each thumb clasped in your opposite hand. After a minimum of 15 seconds, rinse your hands thoroughly under running water. Be sure that all soap is removed, as soap will dry your skin. Pat your hands dry with paper towel. Rubbing with paper towels can damage your skin. Turn off water using a paper towel to avoid recontaminating your hands. Dispose of the paper towel into a waste container.
Do you want me to show the PPE videos as well?
Sure, you might as well keep going, John. Thank you.
1 second. One second.
Perform hand hygiene for 15 seconds. Put on gown. Put on mask. Put on gloves. Remove gloves. Remove gown. Perform hand hygiene for 15 seconds. It is important to clean your hands after removing gown and gloves to make sure that infectious agents are removed before you touch your face. Remove mask. Perform hand hygiene for 15 seconds. It is important to clean your hands after removing facial protection because they are considered to be contaminated.
Awesome. Thanks, John. So the videos that we talked about are all posted there with the link so you can watch them. There's also some visual resources that allow you to watch, to read about it, as well as there are images within the PowerPoint. So on slide 40, we won't show those, but the Center for Disease Control in the US has a couple of videos for donning and doffing as well. So they're there for your reference if you choose to watch them. So what is the appropriate PPE? So we want to think about what is the risk of doing my risk assessment. If my skin is broken, am I going to come into contact with bodily fluids from an individual? If you have things like eczema or contact dermatitis, for example. Next slide. So again, Public Health Agency of Canada, hand hygiene is the single most important practice for preventing transmission of germs. Next slide. So good hand washing, again, is on slide number 42. We've already talked about that. I want to point out, though, that the use of gloves is not a substitute for hand washing. So we often see that when we go and get our blood taken, for example, that the individual taking our blood, and no judgments for lab techs, but in my experience, every 6 months when I get my blood taken is they never wash their hands before they, even with ABHR, before they put their gloves on. So you have to be your best advocate. I'm sorry, could you please clean your hands and then put your gloves on? Don't be afraid to be assertive. So on slide 43 is an image from Public Health, and all of these are free. So if you've got people coming in your home and you feel they need to be reminded, you can print these off and then you can post them up in your home to remind individuals. So it's just a visual of how to wash our hands. It does say 15 seconds. They've increased that to 20 now with COVID. So cover cuts with bandages or wear gloves for added protection. Cuts are very vulnerable to infections. Artificial nails that we talked about, keeping your hands away from your mucous membranes, eyes, nose, and mouth, and assume that any contact with bodily fluid is going to have some infectious agent in it. So alcohol-based hand rubs are preferred when your hands are not visibly soiled. They are less drying. It's the friction that gets rid of germs, just like it is with hand washing. If your hands are visibly soiled, you want to make sure that you wash your hands with soap and water. If you're dealing with somebody with C. difficile, which is a very common community spread infection that is in people's fecal matter, which is loose stool, it loves to live on surfaces for very long periods of time, weeks. So remember that Javex water combination we talked about? That will kill it, but you really should try to get your hands washed with soap and water. There's an image on slide 46 of how to hand rub using alcohol-based hand rubs, again for 20 seconds or until your hands are dry. The 4 moments of hand hygiene are before initial consumer client environment contact, before any procedure where there's a risk of exposure to bodily fluids, before putting on your gloves, after bodily fluid exposure, after removing your gloves, and after consumer environment contact. Because remember, all those high touch surfaces need to be cleaned. All of the PPE is depending on the infectious agent. So gloves protect our hands, gowns or aprons protect the skin or clothing, masks and or respirators protect the mouth and nose, goggles protect the eyes, and the face shield protects the entire face. So in the video, if you're visually impaired, the woman put on a face shield with goggles. If you didn't have that combination, you would be putting the goggles on last because you're going to put your face mask on before the goggles. So you want to don or put on. Don means to put on before your contact with the consumer. You don't want to spread contamination, so obviously hand hygiene first is important, and you want to remove and discard it importantly. And we've changed the hand washing components. Jody's just getting a drink there. We've changed the hand washing components now that actually after doffing every single piece of your PPE, you wash your hands. So in the video, the woman took off her gloves first, then she took off her gown, and then she washed her hands. That was life before COVID. Now you would take off your gloves, wash your hands, take off your gown, wash your hands, take off your goggles, wash your hands, take off your mask, wash your hands. So sequencing, do you put it on? You put on your gown first, your mask or your respirator, your goggles or face shield, and last is your gloves. You want to make sure you've got the appropriate size if you're wearing a gown. So if the gown doesn't fit you, you need to wear 2 gowns. You put the first one on like a house coat. On the back, wrap it around, tie it up. Then you put the second one on forward to backward. So there are reusable isolation gowns that we use in clinical types of settings. They need to be washed appropriately and cleaned appropriately. So if you're using reusable isolation gowns, only one of your attendants should be wearing that gown while they're caring for you, and it should go into a container with a closed lid, and it should be laundered appropriately, and it should not be a gown that has been made. Now, I say best practice. In my life of COVID, working in 2 hospitals and hospice in the community in the last 2 years, I have seen things that I never thought I would see as a nurse. So did we have everything proper? Do we still have everything proper? No. But best practice would be that that's how you would do it. Next slide. Disposable mask and eye protection should be worn to protect your mucous membranes. Disposable masks need to cover your nose and your mouth. We see lots of nose droppers where people keep the mask under their nose, and I affectionately call those the nose droppers. What's the point? Why bother wearing it? It should cover the nose and the mouth to prevent that fluid penetration, and the goggle or face shield or combination mask and face shield will protect your eyes as well. Your own glasses are not a substitute for goggles. Anti-fog features are great, but we don't have them in everywhere. So there are different types of masks that I talked about at the beginning. There's sort of a standard face mask. So the image, if you can see slide 54, that's a surgical mask. So the difference between a procedure mask and a surgical mask is a surgical mask is tied to the back of your head and the nape of your neck. A procedure mask or isolation mask is the one that goes over your ears. Okay, that's the difference. And there's level 1, level 2, and level 3 of those masks. NIOSH or certified N95 respirator is for airborne, which is those small microns that we talked about. So I'm going to get to that in a subsequent slide to talk more about that as well. Okay, we covered all that, John. We're good. So when you're putting on your mask, I think we've covered all of that. If you've got the face, the part that has the bridge over the nose, the metal part, you want to make sure you put it nice and tight underneath the eyes, underneath the chin. They need to be changed, our procedure masks, when they become soiled, damp, or damaged. When is it appropriate to wear your gloves? Anytime you're coming into contact with bodily fluids, incontinence, mouth care, catheter care, bowel routines, suctioning, helping somebody with CPAP, BiPAP, any aerosol generating procedures as well. Always work from clean to dirty, so don't touch your face. I know we may get itchy. If you've got to scratch yourself, you got to go get your gloves off. You got to get your mask off. You got to wash your hands. You got to take everything else off. You know, don't be one of those people that tries to get a clean part of your gown up on your face, because what you're doing is taking all those germs and putting it right in a right place to enter your body. And we never wash or reuse disposable gloves. I haven't seen that in years, but I used to see it in the 80s. Next. How to don your gloves. So we put on do our hand hygiene, and our gloves go on as the last part of putting on our PPE that we saw. First, we want to make sure you wear the right size gloves. You want them nice and snug, not too tight that your fingers go numb, but you don't want them loose to allow germs to go inside. And when you're wearing full PPE with the gown, you want to make sure that the cuff of the glove goes over top of the gown, and the gown is tucked into the cuff of the glove, just so your skin is protected. The dirty parts are the outside parts of things. So if we think about contaminated and clean, the contaminated are the PPE that have come into contact with your bodily fluids. So your gloves, the outside of your mask, the outside of your face shield, the outside of your gown. Clean would be on the inside parts. Next. So when we're going to remove our PPE, we want to remove our gloves. And the best way is what we call a glove-to-glove, skin-to-skin procedure. So you take your one gloved hand to the palm of your other gloved hand, and you pinch it at the palm. You want to stay far away from your wrist, because you don't want to get any of those germs, because remember, the outside of your glove is contaminated. And you're over top of the garbage can. You're not doing this where you're far away from the garbage. You're over the garbage can. You're pulling it straight off. Once you've pulled that glove straight off, in your gloved hand, you want to roll up that dirty glove inside of your gloved hand. And then you're going to go skin to skin. So you're now degloved hand. You're going to take 2 fingers and slide it between your wrist skin and the inside of the glove, because remember, the inside of the glove is the clean part. And then what you want to do is roll it over top of that dirty glove. So now you've got a little package where your one dirty glove is inside of the other, and you drop that in the garbage. And then we wash our hands. Then our hands are clean, so now we can go and untie our gown at the neck and at the back, and then we can take off our gown and we peel our gown forward. And what we want to do is be trying to get at the inside part, not touching the outside part, right? And then we wash our hands again. Then we take off our goggles or our eye protection. If you've got a combination mask and eye protection, then you're going to unloop it from your ears, over the garbage, leaning forward and dropping it straight in the garbage. If you have separate goggles, you take off your goggles. If multiple people are going to use those, you need to clean them. And if you're going to look after multiple people, and then as well, then you take off your gloves and clean your hands. Okay, so that's covered. Slide 63 is just showing you an image of how to take off all of this stuff. Slide 64, hand hygiene, again, is repeated in 65. We really believe lots in hand hygiene, so you're going to see it here lots. So environmental controls, employees clean or sanitize common areas and equipment. Use appropriate hand washing products and dedicated washing sinks outside of the bathroom or laundry room sinks. Cleaning products can be harmful if used and not stored properly. So if you make that Javex water, label it. If you've got a big jug, make sure if you put it into a small spray bottle that you label it for the individual. We clean from higher to lower. We work from far to near. We work from dry to wet. We work from cleanest to dirtiest and change the cleaning cloths frequently. When we're dusting, unless it's contraindicated, use a damp cloth. We don't want to spray all the dust because remember, Omicron likes to live on surfaces. So we want to use a damp cloth to get rid of things, and rinse and wash surfaces that you may have used a chemical cleaner to clean. Next slide. Cleaning frequency depends on how often you're touching the different multiple high touch surfaces in your home. So cleaning with soap and water, then wiping with a disinfectant is great. Using the products, again, be sensitive to clients or consumers who have a respiratory issue and can't use maybe the same ones that you and I use at home. So we're going to talk about self-assessment links, so we won't go on it just in the essence of time because it's 5 after 2 and we still have about 40 slides to go. The self-assessment link is here, so I would encourage you to continue to have your attendants doing that self-assessment link before they come in to your home. And then there is a, oh my God, I've come into close contact with somebody, link on slide 68 as well. What do I do? And that's the slide that's in front of you on slide 69. So this guidance does not apply to people who live, work, or volunteer or are admitted into a high-risk setting. So this does not apply to me when I go to the hospital or the hospice, to a group home type of setting, when I'm doing a visit with somebody living in a congregate group type of setting. So we start at the top and we work our way down, and it's a decision tree. So it says, do you have any of these symptoms? Fever, chills, cough, shortness of breath, decreased loss of smell and taste. If your answer is yes, you go to the box that follows underneath that says yes. It is highly likely that you have a COVID-19 infection, and you must isolate now for 5 days if you're fully vaccinated, or if you're fully vaccinated or under 12 years old, or 10 days if you're not fully vaccinated or immunocompromised. From your symptom onset and until you have no fever and your symptoms have been improving for 24 hours. All symptoms except GI symptoms, which is nausea, vomiting, and diarrhea, that's 48 hours. You need to be clear of those for 48 hours. All of your household family members, if they have previously tested positive for COVID in the last 90 days, need to do that same self-isolation for 5 days. Most people do not need, and that's why we're not doing the COVID-19 test. And truthfully, in the hospital setting, our labs are so overrun, we're only able to now swab people for COVID. The other nosocomial or hospital-borne infections that you normally get swabbed for, we've had to stop doing that recently because we just don't have the capacity. So really important that we're keeping those PCR tests for critical situations. If your symptoms worsen, obviously you're going to seek medical attention and notify your workplace. Then if that's not the answer, then we go to, do you have 2 or more of these symptoms? Sore throat, headache, extreme fatigue, runny nose, nasal congestion, muscle aches, joint pain, gastrointestinal nausea, vomiting, diarrhea. If you answer yes, it's the same box that I just talked to you about, the same symptoms. If you say no, it is less likely that you have COVID-19 infection. So you self-isolate for any symptom for 24 hours, free of that symptom, then you're good to go. Unless it's GI, nausea, vomiting, diarrhea, then it's 48 hours, okay? And I believe John is going to post this as a separate document for you as well, because it's easier to read, it's larger.
Yes.
Thanks, John. So the next setting talks about healthcare workers. So I know there's some question about, does somebody need to wear a mask when they're coming in to my home? So this is as of March 2022 from Public Health. So the setting, and if you want to read all of it, so it talks about every setting, but the setting for home care, individual healthcare workers, so that would be your attendants. If they are providing direct care to client, patient with suspect or confirmed COVID-19, they recommended PPE. This is pending further Omicron investigation and data collection. An N95, which is a mask fit tested, where you are mask fit tested for a proper mask. Isolation gown, gloves, and eye protection. Other appropriate PPE considerations, and I have seen this in healthcare settings during COVID, is a medical mask. So you know how there's the KN95, the KN95 masks? Those masks can be used, but remember, they aren't fit tested perfectly to your face. So they're not going to protect you for all aerosols. But if you can keep the windows open, if you can minimize your direct close contact, which is less than 6 meters, for bouts of 15 minutes, it's much better. Healthcare workers, when there's aerosol generating medical procedures, and they are listed upcoming on the next slide, you need to have an N95 mask fit for those, and all of the regular PPE, the gown, the gloves, and the eye protection. You want to minimize other household members being in the room. If you're doing that, the window should be open if the client can tolerate it, if the cold doesn't make them too cold, and again, minimizing for 15 minutes, and no AGMP we do for greater than 15 minutes. So what are the risk factors for transmission? Your healthcare worker's vaccination status, if they're not fully vaccinated. If the client is unable to mask for source control or is unvaccinated. And again, if you've got that close contact, which is less than a meter for more than 15 minutes while you're performing these high risk functions. So the next slide will talk to us about those high risk functions. So manual ventilation is if you're doing bag mask valving. So if you have a client who needs to have air stacking, you use a bag mask valve potentially for doing that, or a cough assist machine. If you're doing trach suctioning, if you're changing the inner cannula, if you're doing non-invasive BiPAP, or if you're doing positive airway pressure, CPAP, high flow oxygenation, nebulizing machines, if you're using a nebulizer for medication, or high flow nasal oxygen, those are all considered aerosol generating. But please keep watching, because we're seeing changes to what people are considering airborne in the medical world again. Natural ventilation, according to the World Health Organization, is air exchange 6 times in an hour or every 10 minutes. So if you can manage that, that's awesome. And the reference there is on the bottom of slide 73. The coronavirus vaccines do not cause the coronavirus infection. Of the 6 vaccines that are out now in Canada, they will help your immunity in different ways, your body to build immunity. And that's what you want to think about. Health Canada has approved these 6 vaccines. So Pfizer and Moderna and AstraZeneca we're all very familiar with, and it talks about the efficacy of those. I won't go into the details of that. Novavax and Medico are the 2 new ones. Medico is a type of vaccine that is a plant-based type of vaccine, and it's being produced in Quebec. It has not been approved by the World Health Organization as of yet, but it has been approved by Health Canada for use. But that's our big vaccine that we're trying to get in our export. Next slide. NACI, as I said before, is the National Advisory Committee on Immunization. That is the best place to go if you have questions. They are arm's length to the Public Health Agency of Canada. They're independent, not-profit organization, and they are meant to provide you with enough information for you to make a well-educated decision if you want to be vaccinated or not. Currently, our infection rates in Omicron are very high, and we're not 100% sure on the efficacy of the current vaccines against Omicron, but we do know that the illness that people get with Omicron is much less severe if they're fully vaccinated. Whether it's any type of vaccine, those 6, it doesn't matter which one you choose. The efficacy is there on the website for you to keep up to date, because remember, they're constantly doing research, so you will get new efficacy updates on that as well. A longer interval between doses is associated with higher vaccine effectiveness. So the longer you go, if you've had COVID before, your doctor will provide you with information about getting your vaccine at a particular time frame. The longer interval does reduce the myocarditis or pericarditis, which is the heart inflammation that people are really worried about, which is still very rare. So for adults age 30 and older, either an mRNA vaccine or a viral vector vaccine is recommended, and that you continue with those, and you get your second shot 8 weeks after the first dose and 6 months after the for the booster. Next. The intent of a booster is to really restore your protection. That's exactly what it is. But over time, we're going to see the change, or the nomenclature change, based on what the booster efficacy is. So remember, it's still continuing to evolve, and we've got the new VOC, or variant of concern, with Omicron that's being watched now as well. Adults who are frontline healthcare workers having direct contact, physical contact, regardless of the interval between doses in their primary series, is recommended. Those over 50 years of age, those in long-term care or congregate settings, recipients of viral vector vaccines, and adults and First Nation, Métis, and Inuit are really strongly encouraged to get their booster plus or minus 6 months after their last second dose. Next slide. What we have statistically as of March 7th is Ontarians 5 and older are fully vaccinated at 85.9%. Ontario 5 and older with at least 1 dose is 89.8%. Ontarians age 12 or older fully vaccinated is 90.6%. And you'll remember in the beginning of this, they said we needed 90% of people fully vaccinated to reduce the spread of variants of concern. Ontario's 18 and older with a booster dose is at 58%. The total doses is over 31 million that is administered. And as of March the 7th, we had 1,074 new daily cases, hospitalized 693, and our ICUs are at 249. But remember, we're minimizing the people that we're able to actually test. So our data is nowhere giving us the numbers that we had prior to this change that happened in January. So what do? You go on the website that is there, which is covid-19.ontario.ca self-assessment. You take the self-assessment. It will tell you what to do based on the outcome of that self-assessment. Next. So there are multiple steps on the subsequent slides. So if you, these are based on that image that I talked about earlier, but if you have COVID-19, isolating will stop the spread of the virus. You must isolate if you've tested positive. If you live with somebody, they may need to isolate as well. You do not need to isolate, but monitor for symptoms and take all necessary precautions if you've been exposed from another household member. Next slide. Get tested for COVID-19 if you're eligible for testing. So who is eligible is patient-facing healthcare workers, a patient in an ER department, a staff member, volunteer, resident, inpatient, essential care provider, high-risk settings. From the high-risk settings are on that image that John had up earlier that he's going to send you in large print. Home and community care workers, so that would be people that are coming into your homes. Provincial demonstration school, hospital school worker. Next slide. Someone who lives with a patient-facing healthcare worker. So if you live with someone who is a patient-facing person, you are considered a high risk. So you would be able to get tested for PCR. An outpatient being considered for COVID-19 treatment. An outpatient who requires a diagnostic test for clinical management. A temporary foreign worker living in a congregate setting. Underhoused or those experiencing homelessness. Next slide. If you're pregnant, a first responder. Firefighters, police, paramedics, elementary, secondary student or education staff who has received a self-collection kit or a positive rapid test, other individuals as directed. First Nations, Inuit, Métis, and or those who self-identify as First Nation, Inuit, Métis, those traveling to First Nations, and those being admitted or transferred from hospital to congregate living settings. Are a close contact of someone in a confirmed or suspected outbreak in a high-risk setting. Have written prior approval if you have out-of-country medical coverage for OHIP, are in a hospital, long-term care, retirement home, or other congregate living setting as directed by public health. Rapid antigen testing. So there was questions around rapid antigen testing. When and how should we do it? It all depends on the availability, truthfully, of the rapid antigen testing. At my one job, we started off with 3 days a week. 2 weeks later, when we ran out of rapid tests, we went to once a week, and now we're at 0 because we have no rapid antigen testing. So it's all about taking that screener, monitoring for symptoms. So as I said earlier, my 42 years in healthcare, I'm seeing healthcare practices now that I never thought that I would see. So there is no right or wrong answer for rapid antigen testing. They were supposed to start February 9th. My wife and I and our oldest daughter ran to every one of our pharmacies and our grocery stores. We were not successful on any given day trying to get. So hopefully some of you out there have gotten some of those rapid antigen tests, and they are different. Some are nasal, some are oral, some are combination nasal and oral. There are lots of different ones that you can use. There's lots of references on these subsequent slides. John, do we have time? It's 20 after 2. Do we have time to show one of the quick videos, do you think?
Really?
Not really? Okay, so they're there, folks. They're really, honestly, really easy to use. In the hospital, we gave written instruction to, we had so many outbreaks around Christmas that we just left written instructions, and if you were a janitor, you had to go do your own test in the hospital. There wasn't someone there, and we didn't have a video to watch. We just had written directions, and everybody managed to do it. So you should hopefully be able to do it, but the videos are great resources. Next slide. If you get a positive rapid test, so again, follow that screening, follow that document, and the website is there. What should I do and how should I isolate now? You should do another test within 24 to 48 hours because you could be asymptomatic. So if you're asymptomatic, you've got your sort of 5-day window. If you're symptomatic, you need to be rid of all those symptoms 24 hours and nausea, vomiting, and diarrhea free for 48 hours. Next slide. Ontario.ca Exposed is a good website to go to. I think we've covered all that information, John, in exposure on slide 92. What we know about Omicron is that the CDC, the Center for Disease Control in the US, has been collaborating with all the global public health agencies, and we're still learning about its spread. We know that it's more severe to those unvaccinated or not fully vaccinated, more severe outcomes. Next slide. It does spread more easily than COVID and Delta. And because of that factor, and there are people that haven't got it, we're probably going to see way more, especially with all the traveling that took place during the March break. We're anticipating that we're going to see much more Omicron variants. More Omicron cases, sorry. Vaccines, so COVID-19 vaccines and booster shots remain the best way with all those IPAC and remember Swiss cheese, the layers that we still talked about. Scientists are still learning about the effectiveness of vaccines against preventing Omicron. There are breakthrough infections in people who are vaccinated, not as many, but those who are up to date with their vaccines and their booster have much less illness. Well-fitting masks, getting your booster shot if you're over the age of 19 when eligible. Next. Modeling studies estimate that Omicron is more transmissible, we already talked about, than Delta. So there is a big, again, a risk that we're going to see much more Omicron since the March break. The duration of protection from that booster dose is unknown, but it is constantly being reevaluated. The World Health Organization, Science in 5 is a great place to go if you want to get some really quick up-to-date. They're all 5-minute quick little videos. So if you follow the World Health Organization on Instagram, they pop up, which is absolutely awesome. There are treatments that are being, oral antivirals that are being investigated for individuals, but again, self-monitoring and doing the layered treatments, the layered preventions are the best. Next slide. 89.8% of people who were tested between the week before Christmas had the Omicron variant. So that's how we knew it was the dominant variant. We talked about the rest of that already, John, on slide 99. So again, we talked all about that. COVID-19 vaccinations provide considerable protection. Swiss cheese model to prevent the continuation of SARS-CoV-2 getting transmitted to individuals. Next slide. 3 C's means closed spaces, crowded places, and close contact. So you want to try to avoid the 3 C's: closed spaces, crowded places, and close contact. Get vaccinated. Irrespective of the relative contribution of respiratory particle sizes, people can still get a reduction by using that layered Swiss cheese approach. Stay home if you've got symptoms. I think we've covered all of this stuff, John. So the KN95 we talked about, making sure your mask fits you appropriately. Don't be afraid to continue to wear your mask out in public. Home and community care workers, if you've had a resolved test positive in the last 90 days, you don't need to isolate as long as you're asymptomatic. You can work, and we've had people stay at work during high times that did not fit any of the criteria truthfully because we had nobody to care for people. This guidance is a framework only, so you need to be your own best police person for what you're willing, the level of risk you're willing to live with. The next bunch of slides, and I don't think we'll have time to go through them, otherwise we're going to not have any time for questions because it's almost 2:30, but it talks about how we bring people back to work. And this is in a best practice scenario. So obviously the person who is symptomatic, who is still doing isolation, we don't want that person. But if we've got nobody and they are minimally symptomatic on day 4, I have seen, truthfully, those people come back to work wearing an N95 mask and full PPE. Otherwise, people aren't going to get care. So there's a bunch of slides that talk about the administrative sort of considerations. And again, that's in a best case scenario. Our world isn't there right now. We're in a, what's the minimal risk predictable outcome we can do to reduce the amount of vulnerability, and what risk are we able to live with? Okay, I think we covered all that on 109, John. Active screening, not eating meals in shared spaces, proper masks, reduce the risk. Next slide. So there's images, and again, I think John's going to give you the sort of return to work testing requirements for cases and contacts. It basically says to return, if we're talking about low risk to high risk, when you can return to work with your rapid antigen testing, and sort of day 6 and day 7 with the rapid antigen testing. If you have access to rapid antigen testing, you can return to work 10 days after your sort of last exposure when we're talking about a low risk individual. And again, remember the 24-hour and 48-hour requirement. A moderate risk individual, day 7 as well, and the high risk individual can return to work on day 5, because we're talking about hospitals now, and we need bodies, we need people to work. So that's the reality. Next slide. We have something called post or long COVID-19. So the 3 most common long-term effects, and again, this is relatively new: shortness of breath, brain fog, and fatigue. There are over 200 symptoms of long-term effects post-COVID. So if getting COVID isn't enough to scare you, think about the fact that we're now monitoring and looking at long-term. And when we talk about research, we're talking about symptoms from 3 to 9 months after recovery. There are people that are post 9 months that have chronic conditions based on their interaction with COVID. So summary of key points: the Swiss cheese, good hand hygiene, stay home if you're sick, follow those IPAC principles, get your immunizations up to date. You should still get your flu vaccine as well. Primary focus is on prevention. Remember, microorganisms are very small, or germs are very small. You can't see them. So think about all the bodily fluids. Remember, there's bacteria, there's viruses, there's fungi, and there's those asymptomatic people that can be ill 2 days prior to and 3 days after their symptoms go away. So you got to be, just because I look good and feel good doesn't mean I'm not carrying Omicron in my nose or my mouth and going to cough it all over you. Keep up to date with the latest practices for infection control. Follow your public health guidelines. COVID-19 Ontario is a great place, and the WHO is a great place. Sorry, I was talking fast, so let me apologize to people translating. My biggest apology, sorry. I was trying to get through all that material.
Thank you, Tim. We'll do the Q&A that we got questions when people registered. And I'm going to pass it to Rebecca, who has a list of questions.
Sure. Thanks, John. I'm going to be going back and forth from some questions that appeared in the chat and ones that we got ahead of time. We have some direct funding staff here. So one of the questions was about how to apply for the WSIB 3 days of COVID pay for staff who have COVID. So I'm not sure if Abdullah, you want to turn on your camera to answer that?
Sure. I don't see myself on the screen, so I'm not sure if my camera is on or not.
We see you.
You see? Okay, excellent. Yeah, so we have received these questions as well by email from self-managers, and we have provided a link for more information, which that link is also available on this presentation.
It's actually up on the screen right now.
Yes. Okay. So at the end of April 2021, the Ontario government announced the COVID-19 workers income protection benefit, which is paid infectious disease emergency leave for 3 days. And that program was supposed to end in December of last year, but then they extended it to July 31st of this year. I'm sorry I did not introduce myself. My name is Abdullah Duranai. I work for the Direct Funding Program. I'm the acting financial assurance manager, and I use the pronoun he and him. I'm about 6 foot tall. I have a short beard, not a lot of hair on my head. It's kind of gone. So I was supposed to introduce myself at the beginning. Now I want to go back to the question. So from April of last year until the end of July of this year, if an attendant could not work due to a number of reasons, which is going for a COVID test, staying home, awaiting the result of a COVID test, being sick with COVID, or getting individual medical treatment for mental health reasons related to COVID, going to get vaccinated, or experience side effects from the vaccine, or providing care or support to a certain relative for COVID-19. So those were the conditions. If these conditions are met, that attendant could be paid for up to a maximum of 3 missed shifts. Now, there's also a limit for the amount of money that can be recovered or covered under this program. So the way it works is that the self-managers would pay their attendants normally with the direct funding funds on a normal payroll cycle. and then they would apply to WSIB for reimbursement of those funds. Now, when self-managers pay their attendance, they also add the vacation pay, but you cannot apply for reimbursement of the vacation pay portion. You can only apply for a maximum of $200 per day if an attendant was getting paid more than 200 per day. So the maximum is 200. But if the attendant was getting paid less, for example, 100, you can only apply for reimbursement of the $100. And for reimbursement, there's a process that you have up to November 28, 2022 to apply to WSIB. And you can apply online within the same link that we share. You can scroll down at the end and there's a button for apply for reimbursement. And there's a step-by-step process that you can get the money back from the WSIB, and that money, when the WSIB reimbursed to you, that needs to go to the to your bank account that is for the direct funding program. And when you're applying, you would use your name, your first and last name that you have registered your CRA account under that name. You know, you will also need your CRA business number to be recorded in that application. I hope that I have covered everything that is needed.
Thanks, Abdullah. There's a couple other questions related to direct funding. One is April 27th is the planned expiry for all pandemic mandates. How long will direct funding allow claims for PPE or other pandemic responses? I mean, expenses, not responses.
Sure. So direct funding program believes in PPE and the need for self-managers to protect themselves and their workers and community from the spread of COVID. So even though the mandates are ended, but the pandemic has not ended. Our plan is to cover PPEs for the next several months, at least. I cannot give you the exact time because we never know when the pandemic will end. But for the next, I would say for the next 3 to 6 months, I would say that the program would be covering PPE.
Thank you. And then there's another question. Do we continue to pay the attendants the $3 premium until the end of July?
This is a question that we don't have an answer to exactly how the government will move on. The $3 TWE, the way it is structured right now, ends on March 31st. However, the government of Ontario announced that they're tabling legislation to make this permanent. This will be good news to make it permanent for attendance, but there's a lot of work to be done. So currently we don't have any information from the government how quickly they will turn around the legislation, and if it's approved, when can they provide the funding to the organizations, especially to direct funding. But the way it is structured now, the $3 TWE ends on March 31st. Unfortunately.
It's an ever-evolving situation.
That's correct. I'm not sure if Leanne can add anything more on that.
I don't have anything to add. To the best of our knowledge, we believe that it will be extended permanently, but we don't have any more information. We wish we did.
Thanks,
yes,
Anne.
Yeah. And traditionally, every time we receive any new information, we pass that information on to self-managers through memos and emails within a day or two. So whenever we hear something new, we will pass it on to all self-managers.
Great. There's one more direct funding related question and then a few for Tim. And so the question is, can self-managers require attendance to have COVID-19 vaccines and vaccines including flu shots?
Leanne, do you want to take that one?
Thank you. My name is Leanne. I am the Direct Funding Provincial Program Coordinator. My preferred pronouns are she, her. I am a white woman, 5'10" with blonde hair. And thank you for the question. It is our understanding that self-managers can require their attendants to be vaccinated. It's a little dicey one way or the other if they are requiring it after an attendant has been on staff. If you're advertising, recruiting for new staff, you can make that a condition of employment. The employment law around this is ever evolving, and since the vaccines became available, I'm not sure which way that's going. You know, when you're recruiting and when you're interviewing someone who is a potential attendant, you can offer the information, everybody in my household is vaccinated, and hope that they answer the question. I wasn't anticipating the question, so I'm not really sure what the employment law says around this at this time.
Thanks, Leanne. And you can always contact Direct Funding to follow up on these questions if you need more information. Tim, there's a few questions about the mask mandates being lifted and where are people still going to be required to wear masks right now? And then a kind of follow-up question of if you have people coming into your home, like attendants, if the government lifts all mask mandates, is it recommended or can people still require attendants to wear masks when they come in?
Great question. So I think if, you know, we all know that April 27th, I think it is, everything is going to be lifted, the 27th or the 21st, I'm sorry, I can't remember. The chief medical officer of health, then what they'll do is they'll give some guidance or some guidelines. So you remember when it started in the beginning, there was guidance for hospital, there was guidance for community, et cetera, schools. So what they'll do is they'll put out, my understanding is, guidance recommendations, and then you can choose what you want to do with that. So it would be personal choice. We know that, you know, we hit our peak in January, and I mean, that may seem far away for some of you, but that Omicron happened very quickly. If you're watching the World Health Organization and what's going on in China right now, and we know that people have been traveling, and there is no judgment in any of these statements at all that I am saying, we know people have been traveling all over the place. The airports were full. It was like March break. I never saw COVID or Omicron or the new B2 variant. So my personal experience, I would say that I'm not taking my mask off. I'm following Dr. Tam, and she's wearing her mask everywhere out in public, and so is our mayor. I personally, I'm going to continue to wear my mask, and I'm fully vaccinated, but I work in high-risk environments, and I would not want to get somebody sick. I would not want to transfer it to any individual as a frontline forward-facing healthcare worker. I would be concerned as a client receiving services. You know, they're out in the public, and we know that the masks people are going to stop wearing them. Just look at the images of beaches and where people have been. Who knows? And we just don't know what the future holds. So there will be guidance documents, but anybody, you have the right when you're employing people to come into your home, a retirement home, a nursing home, they have the right to say who can come in and what do you need to have, vaccination or no vaccination. So I think that's going to be the bigger issue, not masking, is when we lift the vaccination. To me, that's the more scary part is, you know, now you don't have to be fully vaccinated. to work in healthcare settings. But remember, guidance documents are placed for what we consider what you can do. And then there's what we call best practice, right? So best practice is what you want to have in your organization. I hope that answered your question.
Yeah, and we'll be including the link in the resource handout of where to find the up-to-date Ontario information. So as they make more announcements about what requirements are being lifted, we'll send you the link of where you can find the most up-to-date information.
And I find, Rebecca, COVID-19 Ontario.ca is usually right up to date.
Mm-hmm. There was another question, Tim, about face shields, and with a note that for ASL users, it's difficult to understand people with masks covering their mouths. Are face shields sufficient protection right now?
So interesting, in the long-term care facility where I have students currently placed, frontline workers, they're only wearing masks. They're not wearing face shields. But I have a deaf student. And what that deaf student has done is on her phone, and I'm sorry, I don't know the application, it translates what, so as I'm talking, providing direction, the words show up sort of like what's happening here. And I'm not sure, she has an iPhone, and that's been very helpful because she's a lip reader, so she doesn't sign. So with masks, she's lost, and we can't do face shields, especially with Omicron. Face shields would not be recommended. You would need to, you need a mask.
That's a useful tip to have a kind of live captioning. Otter is an app that people are
Otter, that's it. Thank you, Rebecca.
Yeah.
That's what it's called, Otter. I knew it was an animal.
Excuse me, Tim, sorry. For the interpreter, is that OTTER?
Yes. Thanks, Tim. That's important information because a face shield is not going to protect against Omicron or any aerosol particles, right?
Not at all, no.
There's been a question, are there still clinics for COVID testing available?
Yes, if you are, if you meet that criteria, that I know it was a lot of slides I went through, but it's there. They all get a copy of this, right, Rebecca, to refer back to?
Yes, that slide with the information about who's eligible for PCR tests will be sent out.
Yeah, so that that would tell you whether or not, and it's quite quick actually. I just had a colleague, and she said it was 10 minutes from her phone call. I live in Newmarket. She literally called, and the testing center is by the hospital, and she lives right by there, and she had hers done within 10 minutes of her phone call. But she's pregnant, so she met the criteria.
Yeah. Leanne, I see that you have your hand up. Did you want to add something?
I do. Thanks, Rebecca. Leanne here from Direct Funding. A few months ago, I think it was about a month or two ago, we, the Direct Funding program, offered participants on Direct Funding, self-managers, the access to get a letter confirming that their attendants are public-facing healthcare workers for the purposes of getting a PCR test. As far as I know, that is still available to you. So if you need more information about that, contact Direct Funding. Thanks.
That's awesome. So then by virtue of that, you as a client would, if they had a close contact, you would be part of that eligibility.
Tim, there's a question about transportation. And right now with the lifted mandates, do people still need to wear masks on public transit and also when riding in taxis?
On public transit, you still need to wear a mask. So I'm assuming a taxi. I'm not sure about the taxi question. A public, so if you're on a bus or a subway, But if you're in a taxi with that guy and he's driving lots of people, he's been exposed to lots of people during the day, and there's lots of aerosols in his taxi, I'd be wanting to wear it anyways, personally.
I think we might be in a moment where personal choice that we can decide to wear masks in a taxi, and I wonder if different taxi companies are going to have guidelines for their staff about masking.
I wonder, yeah.
Because you're right, those are people who come into contact with a lot of different individuals. And there's a question, Tim, kind of general, that, you know, looking at the Swiss cheese model, and if we know all of these protections working together are so important, then why are restrictions being lifted?
That's a great question. So somebody who is anal retentive in healthcare like me, I was shocked that they decided to lift them right after the March break. I'm in that, but that is not the most shocking thing I've seen in my 2 years working through this pandemic. Sadly, it's not. And I think that we're going to see more things. I just think there's more to come, and I think we really, truthfully, from the bottom of my heart, we need to think about our own vulnerability and the risk level that we choose to live with, and the consequences of the risk level that others are choosing to live with, and the impact that's going to have on our healthcare system. The care. I mean, I never felt so morally distressed as a nurse in my entire career as I have in the last 6 months, where I truthfully, when I leave the hospital, I don't even have the energy to cry. I'm so tired. And tired because I'm morally tired because I did not give good care. And that is not something I ever wanted to be associated with, you know, at 62 years old and being in healthcare for 42 years. I never wanted to feel bad leaving work, and I feel bad every single shift. I'm just truthfully being honest, and it's not because there's bad people and lazy nurses. Our system was broken before, and it's weak, and it's still broken. And I say that from the bottom of my heart, that it makes me weary that if we take away all of these, layers of our Swiss cheese, and we add on the moral distress of people who have been working for 2 years, I think we've just got a big boiling pot of risk. That's just me as a frontline nurse talking. That's it.
Thanks for sharing that, Tim. I think that's a really important perspective and a really clear, reason for all of us to continue doing what we can to protect ourselves and protect our communities, and support the staff who are doing work like you, because the weariness makes a lot of sense to me. And I think the shock at hearing some of these restrictions being lifted is something I'm hearing from a lot of consumers too.
I'm hearing young people, and it makes me very happy. I'm hearing 12 and 13-year-olds that their parents say, "Oh, you don't have to wear your mask anymore." And these are my own family, and they're anti-vaxxer parents, and I'm wearing a mask to school. I don't care. And I'm like, yes, your parents don't believe in vaccination, but thank God you're still wearing your mask. Because they're scared. Kids are still scared, and I don't blame them.
I just want to add, I am in agreement with you, Tim, and I think most people are, or people with disabilities are kind of concerned, but when I saw the Swiss cheese model, it kind of spoke to me to continue. Like, I've gotten my vaccine, I've gotten my booster, which is the first most important thing. I cannot necessarily wear a mask, but I wear a face shield. I've gotten a doctor's exemption for it. I always practice proper hand hygiene. I've learned so much from your IPAC practices about including your thumbs when washing your hands and ensuring my attendance to a thorough hand washing and wearing proper PPE. My attendants used to actually put their PPE gown over their face shield, putting all the dirt of their face shield onto their clothes. And I'm saying, after watching your video, this is the proper way to do it. You know, it's gown, face shield, gloves, you know, and it's up to us as individual consumers to the type of risk of social distancing and avoiding crowds and ensuring proper ventilation, knowing the kind of screening tests, you know, for us to screen ourselves and on a daily thing with our PSWs. And now that we have rapid antigen tests, hopefully people can get access to some of these free things. And I only use it if I feel like I have a symptom or symptoms. So I don't use it like on an everyday, because I know they're hard to find. And the hopeful thing is medications are being made, one of which is Pfizer, that if you have COVID, it helps reduce the severity, but I know it's still not in full circulation. But during this time of mandates being lifted, we have to be more vigilant as consumers and service providers and practitioners. And this is a reason for doing this workshop. I know that we're running out of time, so I just wanted to briefly say that what will be handed out is a copy of this presentation. You'll be receiving an email from us with a copy of this presentation, a link to the recording, and also separately the resources that are part of this presentation in a Word document that talks about vaccine information and how to get a vaccine if you haven't gotten a vaccine. The WHO, which Tim has said, has these excellent 5-minute videos to know more about COVID and vaccines. Also, there's a lot of data in the resources that you could click on and find the most up-to-date data. There's also the videos on how to do the rapid antigen test that we've all been given. And I think it's the BTNX rapid response that most people are given. It's a 4-minute video, very instructional of how the video and how you're supposed to do a step-by-step process. I know that for most people with disabilities, it is difficult to do a test on your own, or if you're visually impaired, but if you could find a family member, do the proper PPE techniques and do the proper testing, you know, to give peace of mind that you don't have COVID-19. And the links are here, as well as other infection prevention control. There's a free online iPad course, and the link is here at the bottom. And as well as, you know, how to have more videos on putting on isolation gowns, and other government sites, the federal government, public health agency, there's the Public Health Ontario, IPAC Canada, and CDC, and other high-end hygiene and masks. So all this information is there as resources for you to use, and for you to choose which is most relevant to you. And also there is a PPE supplier directory that the Ontario government has put together with some additional PPE suppliers that direct funding has put together as well. And here is the link if you are a self-manager and are looking at getting the 3-day day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day-day- That's what's going to be sent out to you as resources, the PowerPoint, the PPE resources, and the Zoom link recording. We have 5 poll evaluation questions. And I would ask Rebecca if she could start the poll and if people can answer these questions, please. So the first question is, did the workshop expand your knowledge of infection prevention and control, IPAC? Please answer the question, the number you feel applies. So 1 is strongly agree, 2 is agree, 3 is neutral, 4 is disagree, 5 is strongly disagree. Being mindful of time, Rebecca, Jody has to leave in less than 3 minutes, I guess.
Okay, I'm gonna end this poll in 5, 4, 3, 2, 1.
Screenshot.
Yep.
So the next question is, do you feel more confident in using IPAC practices to reduce your risk of exposure in your daily life?
Okay. I'm gonna end this poll in 5, 4, 3, 2, 1.
The next question is, was the information easy to follow?
Okay, I'm gonna end this poll in 5, 4, 3, 2, 1.
The next question, were the resources presented today useful?
Okay, I'm gonna end this poll in 5, 4, 3, 2, 1.
And the last question is, did the workshop expand your knowledge of COVID-19 public health guidelines and restrictions in Ontario?
Okay, I'm gonna close this poll in 5, 4, 3, 2, 1. And we realize polls don't give room for written feedback, so please feel free if you have anything you wanted to share or write to us about this workshop. You can email me at rebecca.wood@cilt.ca.
And I want to say thank you to all the participants coming today. We really appreciate your attendance. We especially want to thank Tim for putting the presentation together, my colleague Rebecca, the direct funding team for assisting us. And also we want to thank the support of the ASL interpreters, Jody and Cindy, and also it's Abby, our captionist. Thank you very much for providing the access accommodations for today. And just finally, as Rebecca was saying, here is our contact info. But Rebecca did give you her email address if you want to give us more specific feedback. And you will be given a copy of the presentation today. So thank you everyone for coming. We look forward to doing other workshops to provide power through information. So thank you everyone.